Good evening. The son of a care home resident in Coventry who died from Covid-19 says his father would still be alive today if the government had acted sooner. A new report by a committee of MPs found the government made serious errors that cost lives.
The MPs did, however, also offer praise to the government for its support for the search of treatments and the rollout of the vaccine. Our reporter Lewis Warner has been looking at today's findings.
85-year-old Rex died of Covid-19 at his care home in Coventry. His son believes if the government had acted faster, he might still be alive. Today, a joint committee of MPs agreed with him. Their report saying serious errors and delays at the hands of the government and its scientific advisors cost lives.
Absolutely devastating to hear this news today, which confirms all my thoughts, all of our group's thoughts in how damning this pandemic was. If this country only locked down earlier and if our government took heed of the warnings coming from Europe, I have no doubt my father would have been with us today.
Some of the report's key findings include declaring the regional tier system as confusing and not good enough at preventing infection spreading. It says if more stringent social distancing measures were adopted during the autumn, that could have reduced the seeding of the Alpha variant. And that the test and trace system was slow, uncertain and often chaotic, and it severely hampered the UK's response to the pandemic.
It was criminal, disgraceful behaviour that caused serious harm.
The committee gathered evidence by speaking to key figures involved at the time decisions were made, including this explosive day of evidence by the Prime Minister's former advisor, Dominic Cummings. At this care home in Sturchley, they know the pain of loss all too well. Over the course of COVID, 5 residents died. For the care home manager, today's report makes for hard reading.
They were severely unprepared, expecting perhaps a flu epidemic rather than anything similar to that we'd seen before with SARS. And I think we lost far too many people at the beginning because I don't think we locked down soon enough.
There was a sort of fatalism about COVID that, well, we weren't going to be able to stop it. And so it was a question of when we should best time the lockdown. And we didn't. And the behavioural experts thought that people wouldn't stand for a long lockdown. So it was, well, better to time the lockdown at exactly the right moment so you get the most bang for your buck. We now know that people were incredibly compliant. The efforts of the British people, the people in the West Midlands, the people in my constituency of Newcastle-under-Lyme were amazing.
Paul doesn't remember much of the first lockdown. After testing positive in March, he spent 102 days in hospital, 8 weeks of which he was in an induced coma.
I think quite possibly the closing of the borders, but like Australia, it would have been a lot better for Britain to have the borders closed. We're an island. We could have contained it, could have kept it out. We have to learn from the pandemic and how things were handled, the mistakes that were made, the positives that were made, that were learnt.
Well, the Prime Minister said last May that the government is responsible for everything that happened and we're sorry for the suffering that the country suffered. And we've committed to an inquiry to ensure that the right lessons are learned from the pandemic.
The government insists the measures taken were guided by the science to keep people safe. Measures, though, that sadly didn't save everyone. Lewis Warner, ITV News.